good way.
I'm just recording so I don't miss anything.
Oh, cool.
We haven't officially started, but yeah.
Okay. Yeah, so they've been thinking about doing this for years and years, and the pandemic coming along last year. One of our other partners, Heywan Chu, I think you communicated with him a bit. He had a camera. He's recorded some things in the past and done some editing. He said, you know what? It's slow. The residents aren't able to come and scrub these cases. Maybe there's some way we can still keep educating despite all these things going on. So it started out that way, just recording some videos and editing them and doing some voiceovers.
That's awesome. And so I think you gave me some questions here that I'm going to use. And as we start, and basically this is going to go to that present group, Alan's group. And so hopefully it might drive some interest. And are you the entrepreneurial guy? Like, do you know about the subscription Kajabi type of stuff, or are you more the recording editor type guy?
I do recording, voiceover. I do reach out in marketing too. But a lot of my focus is with residents and students. So I try to communicate with them as far as use of the website and how I think it can benefit them. And then I also offer, especially for students, to do practice interviews and things like that to get ready for residency as a part of the website.
Cool. Okay, I'll get started here.
Cool.
Hello and welcome to Podiatry Practice Mastery. My name is Don Pelto and I have Dr. Paul Whitehouse, and he is part of the group that's developed the Foot and Ankle Surgery Academy. So welcome, Paul. Thanks.
Thanks for having me, Don. It's nice to see you.
Yeah, nice to see you. So we were talking a little bit before about how this kind of the FASA group started, and you told me it was the pandemic and not having resident scrubs, and you guys just said, hey, let's get our camera and start recording the procedures, the surgical procedures. How is that going for you guys? How is the workflow? How is it improved and things like that?
Yeah, so it's been pretty interesting, you know, like we were talking about, kind of the brainchild of Matt Cobb and Zach Haas. That's been something they've been thinking about a long time, is how can we increase resident and student education. And one component that's always been missing, you know, surgery opportunities and the hands-on experience, it's hard to replace. Textbooks are great, but what's the next step up there? What's the evolution in education? So it's been kind of a thought process of theirs for many years. When the pandemic hit us, residents weren't able to scrub cases, at least a lot of the elective stuff. Yet we still want to educate them and make sure they're getting trained as far as surgical treatment is concerned. So Heywan Chu, another partner of ours, he's got some little experience in editing, recording. He said, you know what, let me just show up, record some of your surgery cases and see what we get out of these. We love the quality of what we were able to record. We started voicing over, and it kind of grew from there.
That's awesome. Similar things to this, I guess, would be where this is going to be hosted, which would be Present or Podiatry. They have some lectures, but it's not really surgical. I think ACFAS probably has some. Sports medicine, they have some similar things. So those are the other places, right, where they have similar videos, right? What makes you guys unique? Yeah.
Yeah, you know what? I think those are great resources too, and I used a lot of that when I was doing my training as well. I think what's a little bit more unique about Foot and Ankle Surgery Academy is the fact that it's actual live surgical procedure on actual live patients. So most of what you can find out there, they're cadaveric, not much clinical background to them. So here, the difference is we see true deformity, we see it in actual patients, and then we always provide follow-up too, whether that's a surgery that turns out really well or something that might need revision down the line. We show every bit of it. The other part of it is it's recorded by a foot and ankle surgeon, so you get that unique perspective of their view and the detail, which we think is important, of course, for what you need to know surgically.
Now, talk me through the like, I don't know if you have any children, but I'm super, like, I'm over, like I try to do too many things. How do you four guys find time to do this? Do you have like block time set aside? The recording is the easy part, right? You just have the extra guy scrubbing that records. That's the easy part. How about the voiceover, editing, uploading on the website? It's called a Kajabi site that you guys use and all that stuff. Who does it? Is there a who that does that? Or do you guys do it in your spare time? Or
yeah, it is really on us, and a lot of credit to Dr. Chu, who does the majority of our editing. We also have this new resident who helps us out. But yeah, it's all done by us. That you're right. The surgery part's really simple. We're operating,
doing it anyway.
Someone's there recording. We're going to do it anyways, right? We find time just before clinic. So if it means we get up at 5 o'clock and do some voiceovers, that's what we do before our clinic. Or if we stay a little bit late and do some voiceovers, it's that part's also really fun. We get to discuss cases. We can critique each other. That's a lot of fun to do. But the editing, I think that's the tough part. And Dr. Chu, huge credit to him. He does all that on his own. He's got a wild schedule where he's on call, which is very unpredictable. So oftentimes you'll find him in the hospital or the physician's lounge with his computer doing editing in between cases. So it's just where we can find it.
It kind of reminds me because we teach residents here in Worcester where I'm at, and having these like almost surgical rounds where you kind of talk about the cases. In the past, what we do is we throw up the X-rays and you walk people through. But how much better instead of just now? Do you guys throw up X-rays, MRIs, and then do the surgery, or is it only the surgery?
Yeah, we do. So we always start with pre-op imaging. So we'll start with the pre-op imaging. We give a little bit of a clinical course, what the patient's been through, what their symptoms are. And then we'll ask each other questions about, okay, what do we see here? What do you think would work for this patient? So if that's just plain films to any advanced imaging or clinical pictures, we share all of that. Then we transition into the surgical procedure itself. And finally, at the end, we go into their post-operative x-rays, which we always get follow-up until they're back in regular activity, regular shoes.
And then is there any opportunity for those that are, I guess it's a membership site. So are there opportunity for members? Hey, I have a question on this, this tarsal tunnel release you did, is that a group chat or is that an individual chat to the doctor? Is that everyone can look at previous questions? How does that work?
Yeah, that's a great question. So we want this to be really interactive. It's not meant to be a passive way of learning. So we do have different memberships, which allows you communication and even case submissions. So we encourage all of our members, if they have questions about our particular cases, why we did what we did, or even if they have comments on what they would do differently, we respond to each of those with email. And in fact, some of them we take and do a full video answer on and put that up on the website if it can contribute to everyone's education. And then we also encourage case submissions. So every once in a while, when we get a case that's tough, that someone just wants to run by another group, we're happy to look at it. We meet as a group, go through the x-rays together and discuss what we think would be a good treatment plan and why.
And you record that as another video?
We do, yeah. And then we share that on the website as well. Yeah.
What's so neat is it's kind of like having someone as a fly in the wall with like really skilled surgeons that, you guys, and then you could just talk about. And so that it's kind of like the colleague that you don't have for a lot of people.
Yeah, I think that's a great benefit to this resource. If you're in private practice alone and you just like, man, I wish I had someone's brain to pick on this. It's a great way to do that. Or even if you're in a bigger group and you just want someone else's peace of mind from an outside perspective, right? I think there's so much benefit to that.
Well, Paul, this is something that we, I'm younger, just kind of like you are. Like this is what I hear. They used to go to conferences and they bring their x-rays and hey, what would you do here? What would you do here? At these conferences. And now we're so separate due to COVID. We don't go to conferences or streamed conferences. And I think this just really offers almost community, I think.
Agreed. Yeah, I think that's a really great part of it. We love interacting with people. So even last year when it was everything shut down and the students transitioning into residency, they were doing their interviews over Zoom. So it's so hard to prepare when things are that way right now, right? And then, or if you have less surgical exposure, just because we're scheduling less elective cases.
Yeah.
So yeah, we try to encourage all, community vibe for sure.
How are you guys? How are you making this known? I didn't really know. I don't know how I learned about it. I think I was looking up different membership sites and I'm like, wow, this is kind of, or so maybe someone told me about it. How are you guys spreading the word?
Yeah, I think probably one of the biggest ways we're getting the word out is just social media. Instagram is a great resource. I think a lot of surgeons use it now to share their own cases and experiences. So that's what we've done, and we've got a great following of students and residents on there. And then we also use LinkedIn as well. So each of those sites, it's a great way to just get a taste of what we're doing. Specifically on Instagram, we post short edited versions of the full videos we put on our website. So it's basically you get a little snippet of what the full conversation and the full surgery looks like.
That's awesome. Any tips in terms of, it's not really a malpractice question, but in terms of HIPAA patients, I'm sure you get that question a lot. What have you guys determined in your thoughts on how does that work? You get consent for these things? You just not show people's face and names that are identified? How do you determine that?
Yeah, definitely. So we are very honest with our patients. So we tell them that this is something we do. If it's a surgical case that we will record, we discuss it in detail with them. Everything is completely de-identified, and they also sign consent to it too. And obviously, we like to share what we do, and we're confident and proud of it. So we actually let the patients see some of the work as well.
That's cool. Now, where do you guys see yourself, Paul? Let's say if we go through like 3 years from now and you look back, where do you see this? Is this going to expand? Would you like it to expand beyond surgical videos? Do you want to add other things to it? What do you guys see yourselves in a few years?
Yeah, I think we want it to be kind of an all-inclusive type of training environment. We want to do everything from student preparation and education with simple surgical skills like suturing, assisting, to residency where you learn how to do actual procedures, to applying the stuff in real life as an attending. So we want to see it grow. We want it to, we want to be a huge part of student education, and we want to be a huge part of resident education. So a little bit of each of the components, and hopefully one day each specialty finds some use in something like Foot and Ankle Surgery Academy.
That's awesome. Now, I'll kind of dive in deep because I'm kind of passionate about this membership sites, and I think every podiatrist should have their own email list membership site. And so that's what I really applaud you. So, for those that are listening, how has the growth been in terms of drop off? Like people, it's like $50 a month, and then some will drop off, and people are just too busy to do it forever. I think you might do it where you're preparing for something or you want to learn about some cases. How is that working in terms of subscribers, people dropping off, things like that? How is that working?
Yeah, that's a good question, because we want people to join and be, a lifetime member. And we want to offer them something that's of value to them, that not just for, oh, I want to see how an Austin bunionectomy is done, and I'm done with the website. So we offer different kinds of memberships, anywhere monthly to yearly. Obviously, they come with a discount with that too. You can see at footandanklesurgeryacademy.com if you're curious about it. But as far as retention goes, we're just constantly trying to grow and evolve our library. So each week we're trying to put at least one case on there. We do we're adding our grand rounds cases on there. So that's where we have our discussion with our local residents on difficult cases. And then, like I said before, as we get them any case submissions, we add those too. So our library is constantly growing, and I think there's probably thousands of videos that we can do over time to add here.
It's well, I just want to, for those that are listening that are interested in doing this, you're basically are just making use of what you're already doing. So you're already doing grand rounds with the residents, you're just recording it. And exactly. Is that a screen? You're just recording a screen, or do you have a video camera like looking at the back of your heads as you guys presenting cases?
Yeah, we're usually just sticking to the screen. That way everything's up there. Yeah.
Yep. That's easier.
Yeah, a little bit easier to do. And then, we've got our microphones and everything, so we can get some good quality audio from it.
Yeah, so that's what I'm trying to do with this Podiatry Practice Mastery, right? It's like basically a junk drawer of all the videos, but then eventually developing, I think I've just got to 300 members. And so at 300, that's where I'm going to, okay, now it's time to charge, right? And that's always the hard thing. You guys probably dealt with that the same way I'm dealing it. Like I would do this for free because I enjoy it so much, but it's like a lot of work. So you have to kind of set a price on something. And if you don't pay, I don't think you value things. How is your discussion in your head with this? Like, how much do we charge? Should we charge? Should we just give it away because we love doing it? Does that go through your brain, or are you guys just altruistic?
Yeah, just completely. Yeah, I mean, you're right. You put a lot of work into something like this. There is a ton of value into it. If you look at our pricing, we're fairly cheap, I would say, as far as education resources go. You spend $1,000 on a textbook and it's not too interactive, right? So I think the value is there. But yeah, we struggle with it because we've all been there. We were all poor residents trying to save every dime we possibly could. But I think we have so much to offer here that it's worth the small price to pay, for sure.
Yeah, Paul, I think I'm an idea guy, and I'm sure you're thinking about this, but what would really take it to the next level is you guys using these videos for CME, right? That would be a no-brainer. Yeah. I'll pay you guys $50 a month for the rest of my profession to get all my CME from FASA. It's a no-brainer, right? So I'm sure that's on the horizon.
It is, yeah. We actually been looking into it. I think that'd be such a great, especially as we see now, right? So it's hard to get to conferences, and even in a normal setting, it's hard to take time out of your clinic schedule. If you can do some continued medical education on your own at home, I think people would find a lot of value in that. So that's definitely in the works for us too.
Cool. So I think we kind of went through most of the things about this. If you want to tell people any last parting words, and then where they can learn more, what's the website and what's the best way? Is there a trial period, things like that?
Yeah, if you want a good taste of what we do, just find us on LinkedIn. We're Foot and Ankle Surgery Academy. Instagram's a great place to see some snippets of our videos. So follow us there. That's Foot and Ankle Surgery Academy as well. And then to keep it simple, the website www.footandanklesurgeryacademy.com. You can see our different pricing tiers and get an idea of all the library we have up right now. So yeah, I encourage everyone to check it out. I think it's a great and valuable type of resource, and would love to have you join and be part of the community.
Great. Thank you, Paul, for your time. Appreciate it.
Thank you so much, Don.